Hi everyone, I hope you're doing well. My name is Mackenzie from MedTech Actuator, and I'm very excited to talk to you about the J-StarX HealthTech Gateway General in APAC and Europe program today. So MedTech Actuator, just to get you started and introduce us, we are a MedTech, biotech and HealthTech venture catalyst. And this means we work with healthcare founders and the innovators who are looking to transform healthcare at the very early stages and help them to catalyze through the programs we run, the companies that they are building, the medical devices, the innovation that they are bringing to market so that they can impact lives, improve patient outcomes, and change healthcare, which is really exciting. And so we work across the Asia Pacific region, based in Australia, Singapore, and now most recently Japan. And over the 10 years that we've existed, we have worked with over 200 startups, I should say, and who have a market capitalization of over $6 billion. They've raised over $1 billion of capital, created a number of jobs in the market. And so through our programs, we have trained over 5,000 different people, from clinicians to academics, all about the foundations of how do they commercialize medical innovation and medical research so that they can develop products that will actually be used by clinicians, used at patient bedsides to really impact healthcare and boost their ecosystems that they exist within. And we do this with our partners. And so we run programs and we love to bring different people from the ecosystem and help ecosystems really flourish and thrive by engaging with partners at many different levels. So whether that's working in a local ecosystem with local mentors, investors, clinicians, hospitals, right through to some of your large medical multinational corporations such as Johnson & Johnson Innovation or Medtronic, Boston Scientific. We build programs that bring all these people together, put them around healthcare founders so that we can really provide all of those benefits to healthcare founders. They can navigate their journeys more easily with experts by their side, supporting them from day one. And so here in Japan, we work with JETRO, we work with the Osaka Chamber of Commerce and Industry, as well as a number of the local universities and even some hospitals, where we're able to bring in great people around Japanese healthcare founders to help them figure out how they'll get their products to market and how do they navigate that journey. And so this program, the J-StarX HealthTech Gateway General in APAC and Europe program, is really about fast-tracking your healthcare venture from about a seed stage to a Series A. And so this is really for founders who are early-stage medtech, biotech, and health-tech startups. So you might be pre or post company incorporation, but essentially you're building a healthcare technology. You might be a founder, you might be a researcher, you might have some kind of medical innovation that you've been working on as a PhD student or as a biomedical engineering student. Perhaps you've also innovated from your workplace. So you might be a doctor, you might be a healthcare worker who has a fantastic technology that you're looking to commercialize. This is the program for you. And please reach out to us if you think that you might be the right fit, because we would love to meet you and love to chat about this program. But essentially, it is for anyone who has an early stage innovation in human health that they are working to commercialize, and will really help you understand the foundations of commercialization, how to navigate that pathway, and connect you to the right people so you can achieve what typically takes about 3 years in 12 months through this program. So the program right now, I'll give you a quick overview, but we are at phase 0. So applications are open and I encourage you to apply. There is a QR code at the end of this presentation, and you've probably found the application page already if you're watching this video, but they do close on the 19th of September. So don't hesitate to reach out if you have any questions about the application process. Now, the program starts with phase 1. So phase 1 is all about what we call intensive sprints, where we come together for 3 days every month from October to January. And we'll be welcoming 20 teams into this phase. And essentially, over those 3 days, we cover the foundations of a commercialization strategy. So all of the different topics that you need to know, from intellectual property to business models and pricing to finances, leadership, pitching, and how do you actually tell the story of your startup so that you can build your commercial strategy as you move your technical product forward in your own time. So it's 3 days at the beginning of every month with those sprints listed here. So there are 4 of them. 3 will take place in Osaka, and we even have the opportunity to all join Hack Osaka in November. And then we will be visiting Tokyo for one of those sprints. And they will run from 10 till 5 p.m. every single day when we are in our intensive sprints. So the dates are there, and please reach out if you do have any questions about that. Then from phase 2, when we have 20 startups, we actually will be only inviting 10 startups to participate in phase 2. So the way we assess teams is through our Innovation Assessment Board. And so this is made up of key ecosystem experts such as healthcare executives, intellectual property experts, regulatory reimbursement experts, who will join us and assess your teams. Teams will pitch on the last day of that intensive sprint in Osaka in January, and then we will assess the teams and let teams know at the end of that month if they have been selected as one of the up to 10 teams that will go on to the tailored acceleration phase in phase 2. So this phase will run from February to April, and essentially it's really customized and goal-oriented around what you are looking to achieve. And so we really meet with you, we help you think about your strategy and where your gaps are in your plans, and then provide you with the right connections to our network of entrepreneurs, clinicians, and experts in residence, so you can start to de-risk your startup and really think about your strategic gaps and how to fill those and develop your strategy further. So you come out of this phase with a really robust strategic plan. In addition to this, we'll host a number of strategy days across Japan with possible locations including Hiroshima, Sendai, Nagoya, Kyoto, and essentially we'll engage with those local ecosystems where you'll get to meet and explore hospital innovation spaces, perhaps innovation spaces attached to different universities, clinician networks, investor networks, and essentially bring that local ecosystem around your startup to really help you navigate all the ups and downs that you will need to navigate in the future. And so in addition to this, these two elements, the strategy sessions and those local ecosystem networking sessions, essentially you'll be ready to showcase your innovation to investors, international partners, and the wider ecosystem in Japan at the end of this phase, which will be in April. And so then we move into phase 3, which is all about globalization. And so from May to June, we'll host a number of international week-long immersions. There is one scheduled to Sydney to attend MedTech, and then there is also the plans for an optional attendance to Health Europe, which is hosted in Amsterdam. And so what we'll do in these week-long immersions is you will get to explore that local health and innovation ecosystem. And so essentially it's an intense week of networking where you'll get rapid warm connections to ecosystem players who really want to assist and work with you. It might be business development opportunities, so you can start to think about, if we ran our clinical trials in Australia, how can we access the right patient population, or what incentives are there for us to set up as a global company in Australia? It might be thinking about how you can connect across Europe and what regulatory environments are similar to yours. And so we really bring that network around you in those local ecosystems so you can start to think like a global company and really build your startups and your plans with that expansion map in mind. So you're not just a Japanese startup, you're a global startup from day one. And so then we end the program with a demo day and investment summit, which is really exciting because you'll be able to get up on stage and pitch your startups after a lot of practice through the program. And this is going to be an in-person and online demo day where you'll showcase what you've been building and your future plans to the global ecosystem. And that will include investors as well. And most startups tend to launch a capital raising round during this time. So it's a really great way to put yourself on a stage and showcase all the amazing innovation that you plan to bring to market. So the commitment, we would love to see at least one team member attend each activity throughout the program. So when we run our programs, there tends to be someone who leads the interaction. This might be your CEO, it might be your lead founder, perhaps you're a solo founder. That's fantastic. But we do allow additional team members to come for each of the sprints that we run and some of the other activities. So you can manage your time across other team members, but we would require one person to attend each of the activities that we run. And then you can share the other commitments amongst all of you. So you don't have to work with us every single day from October till June, but actually just those 3 days when we come together, we expect you to be there. And then when we run the strategy days and other activities, we expect you to be there as well. And then, of course, working on your startups outside of the program so that you are making progress and you are moving forward. We would like to note that for the first sprint in Osaka in October, we do expect at least one participant from each team to be there in person. So as I mentioned earlier, we will have some online attendance options available for people who are not based in the cities we run the sprints in, but we would like to see everyone meet us in Osaka for that very first sprint so we can get to know you. We'll be having a really fun launch party as well, so you can get to know all the participants and feel a part of a cohort, which is what we love to do. And then, as I mentioned, there will be some translation technology available to really help you, especially if English is your second language. And so I mentioned that here as well in the eligibility criteria. So in terms of what makes a team eligible, you just need to have a company or a startup project or perhaps even a research innovation activity that is based here in Japan. So you need to have plans to set up your companies and build a startup in Japan, but you don't have to be a Japanese national if you happen to be someone doing a PhD or something along those lines. You can be an overseas from overseas, but just note that you do need to have plans to set up your company in Japan. You also, as I mentioned earlier, need to be working on MedTech, biotech, or digital innovation or health technology that is in human health. We've had some applications for animal health, but we really focus on human health. And then lastly, again, some level of English reading and speaking capabilities. We will have those translation technologies, but you need to be able to have some conversational level and be prepared to pitch in English your startup. And then lastly, just a reminder, you don't have to have incorporated your company just yet, but it's welcome if you have already, that's totally fine as well. So just reach out if you do have any questions about eligibility. Now, the selection criteria. We assess teams on a number of elements, particularly what stage that company is at, what the potential for impact is, what's their motivation to join a program and to build a company, and then a few other elements as well. So when we talk about stage, we really mean where are you at today and what are your plans and how developed are those plans. So this could be how much funding you've raised, where your product is at in terms of prototype or is it a concept, then how much validation you have done. So how much conversations have you had with clinicians or people who will use your product? And then how developed is your plan around your commercialization strategy? Then we look at impact. So what is the level of innovation that is within your technology and how innovative actually is it? What is the potential for your market that you are looking at and how big is that reach? What's the impact potential there? We also look at what is your global ambitions, what is your ability to engage in the program and actually attend some of those sprints, particularly that first sprint in Osaka. And then how are you commercially oriented? How does your team align around your plans to build a global company? And then lastly, we look at the clarity of the information you submit and some of the cohort dynamics as well. So whether we've got a large number of medtech companies, biotech companies, health tech, who are the different founders, where are they from across Japan, and making sure we've got a great cohort dynamic established as well. If you're unsure about any of the selection criteria, again, please reach out to me. So the application process, they are open now and you can go to the Jetro application page. The link is there and there is also a QR code on, I think, the next 2 slides. But essentially you'll need to make a Jetro account and then complete that application form. But you also need to upload a pitch deck with your application. So this is maximum of 10 slides. It can be a presentation on your startup, a pitch deck. If you have one that is nice, refined and ready to go, that's perfect. Just be aware, maximum 10 slides, and I would recommend putting that together first before you start the application form. And again, that deadline is the 19th of September. And then we are also planning to schedule a few interviews if we do want to meet some of the teams and just get to know you, learn a bit more about your technology. So be aware that we might reach out to you. So the key dates, as I mentioned, applications are open right now and they close on the 19th of September at 12 p.m. JST. Interviews, if they are called, we plan to host some on the 13th of September on Friday and then also on the 20th of September, but these you'll know if we will reach out to you if we want to schedule an interview. And then lastly, we will let teams know by the 30th of September if they have been selected for the program. And then the program itself will commence, as I mentioned, that first sprint in Osaka, which we would love to see you all at. That starts on the 21st of October. That runs from 10 till 5 p.m. and that's at Jam Base, which is close to Umeda Station, so not too far from sort of the central area in Osaka. Then lastly, I just wanted to say, please reach out if you have any questions, if you're working on a healthcare innovation, or if you know someone who might be a great fit for this program. We are in Osaka right now, and we would love to meet with you. So please don't hesitate to apply or contact us. We'll also be holding a number of information sessions in Osaka and Tokyo. So if you can make it along to those, we would love to see you there. Thank you so much, and we hope to see your application and help you build your startup going forward. Thank you.